Hospitals across the country are running short on resources, leaving it up to physicians to make tough decisions about patient care. Alexandra Rangel joins us from Imperial County with what is happening at our local hospitals in the Imperial Valley.
As rationing care becomes a reality for hospitals across the state, local hospitals say they have not reached a point where they have to choose between two patients.
We will do whatever it takes to care for the community.
Both El Centro Regional Medical Center and the Pioneers Memorial Healthcare District have seen an unprecedented amount of patients during the pandemic. Although capacity limits have been tested and at times reached, both hospitals have managed to allocate enough resources to meet Imperial Valley's current demand. The second wave of coronavirus by no means has been smooth sailing. Local emergency rooms are packed and resources are running short, but ECRMC says it's managed to find a bed for each patient that shows up at the ER.
The idea of rationing care, how scarce resources are allocated, is a decision made every day in every hospital. But we haven't had to decide life and death situations. We haven't had to get to the point where we say, is a 95-minute baby more important than a 95-year-old grandmother that has come into our ED? We're not there.
PMH CEO Larry Lewis said in Thursday's press conference that the biggest issue at their hospital was staffing and not having enough respiratory therapists to care for COVID-19 patients. Neighboring counties like Los Angeles are facing far greater perils. Just this week, several hospitals reached a breaking point and had to turn away ambulances with severe patients, as reported by the LA Times.
It has not affected us, but I know in LA County it has, and it's been very difficult. I know that the state also has the emergency management system that reallocates resources to where it's needed. So it might take some from up north in San Francisco or whatever to bring down. I'm hearing that that's actually what's happening, is that there is constant infusion of resources into LA to care for it.
Although COVID-19 cases have peaked during the holidays, moving forward, Edwards says he doesn't think Imperial County will reach a devastation point like LA County. But that doesn't mean that tough decisions aren't being made day in and day out.
We're not there. We haven't been there, and I don't think we'll be there. It is not also the idea of whether this next vent, which is the only vent, could be used on one person. But we have guidelines and criteria, and that's why I refer you back to the CDPH guideline that's we are using, because it helps us make those determinations. It helps the ethics committee and the MEC makes those determinations.
Both ECRMC and PMHD have adopted crisis care guidelines as directed by California public health officials. This helps both hospitals work together during this critical time. It also provides oversight to physicians and ethics boards about providing ethical and adequate care for each patient. With no signs of the virus slowing down anytime soon, both hospitals say they're in constant contact with the state's health department to allocate resources for the pandemic. Reporting in Imperial County, Alexandra Rangel.